So let's get this party started and get ourselves to lunch. I'd like to invite our three dragons to come on stage, and as you're coming up, I'll explain who you all are. So first of all, we have Peter Devine. He's Head of Strategic Partnerships at Ulster University and the Project Lead for Cognitive Analytics Research Lab at the University. Mary-Ann Pearce is Founder and CEO of Map Digital, an on-site and online event design and engineering agency. Hope I got that right, Mary-Ann. Perfect. And Mary-Ann is also the first global diaspora ambassador for the Awaken Hub, which is the first all-island programme for female entrepreneurs in Ireland, so well done on that. And finally, we have Sean Flood, who is the founding partner at EFO Ventures, an early-stage investment and incubation studio with a focus on companies in the mobility, clean tech, health and wellbeing sectors. So there we go, I got that out of the way. Hopefully I got everybody's stuff right. Now, I've been struck in the past 24 hours, not just with the innovation in the room, but actually the use of language, and we've heard many different languages spoken in the last day. And it reminded me of an old Norwegian word, which hopefully there's no one from Norway here because I'm probably going to butcher the use of it. But dugnag is the cultural practice in Norway of people coming together for the common good of their community. And whilst Dragons Den pitches are always seen as a competition, and they are, one of our 4 pitchers will win a nice prize and it'll be announced tonight. I wanted to flip it on its head a little bit today and think about it from a different perspective. So, whilst we're going to have 1 minute of pitch and 3-minute Q&A, I want everyone in this room, because what we have here is a group of innovators, key people in ecosystems across not just Europe and America, but the world. And instead of sitting here listening to 4 pitchers and thinking they were pretty good, what amazing entrepreneurs, I want you all to sit and think about, can I help one of those people on stage? Can I do one thing today to help that business? Because these are 4 innovators who will be the people you will talk about in 10 years that you've seen them today. So think about how you can help them. The power of the community in this room, and community is a word that's been used a lot today, the power of that community is phenomenal. So think very hard about how you can use a bit of dugnag in there. So enough of that. We have our first pitcher who is actually coming to us via the world of Zoom. So hopefully we're all good with this and it works out well for us. So we have the CEO of Nosh Technologies, Sandeep Day, who's on with us now. Sandeep, welcome virtually. Hope you're well. Sandeep, we're going to hand over to you, and when you start talking, your minute is ready to go.
Thank you so much for the introduction. Good afternoon, everyone. I am Sandeep Day, the CEO of Nosh Technologies, where we are leveraging artificial intelligence, blockchain, cloud, and edge computing to fight food waste and hunger. Every year, we waste more than 1.3 billion tons of food, which contributes to almost 10% of global carbon emissions. Our flagship product, the Nosh App, is an AI-powered mobile solution to help consumers optimize their consumption and make data-driven decisions to reduce waste, save money, and improve sustainability. Nosh provides in-app shopping planning, better management of food, recipe suggestions, weekly analytics on food buying and wasting habits, in-app news and media consumption on food industry, and the ability to buy food at a discounted price. We have already helped more than 17,000 users to save more than 280,000 food products and reduce carbon emission by 142 tons. To learn
Sorry,
more,
Sandeep, we're really tough on the 1 minute on you. I forgot to say that. Honda really shouts at me when I let people talk for more than a minute. So, Sandeep, thank you very much for that. We've got 3 minutes of questions. I'm going to start with you, Sean. You're in that sustainability space, and what's your first question for Sandeep?
Yeah, so I think the food waste is a fundamental industry that you should be focused on. Can you tell me just the business model? So the first product, is it in-app, subscription-based, or is it sponsored? What's the business model behind it?
So we do provide premium subscription. At the moment, it's freemium in nature. Like, we are using AI to build the weekly analytics that helps the user to be more aware of how they are buying food and wasting food, so that they can take a better decision next time they go out shopping. So that will be having far more advanced feature, which will be under the subscription. Moreover, we are also using AI to create new recipes to help user to use up their food items that they have bought. And that will also be moving to us like under the subscription as well. Apart from that, although Nosh, the B2C side, which user can download from App Store or Play Store, that is mostly using the freemium or subscription-based services. We also provide B2B service, which is a Nosh solution to help every stakeholders in the whole food supply chain to optimize waste and improve profitability as well. Recently, as a company, we have also developed the world's first AI-powered blockchain framework that helps the every entity in the food supply chain to optimize waste without threatening food security as well. And to help the whole food supply chain, we have also made our intellectual property available as open source. But apart from that, we are working with several food vendors and like stakeholders in the supply chain to provide them software solution to help them with optimization of the food waste.
Brilliant stuff. Miriam?
Yeah, I would like to talk about your revenue model. You said B2B sponsors, and you just talked about the food chains. I mean, will you be working with multinational food suppliers, distribution networks, and what kind of revenue model do you hope that they'll help support you with?
Absolutely. So on the B2B side, we provide the whole software solution. So we help them to digitize their food data. And at the same time, we employ machine learning to help them understand how food is being wasted at which stage, especially in their manufacturing facility. So we are providing them the whole software to do this, to perform this. Apart from that, actually on the Nosh app, currently we have a feature called Nosh Shop, where user can buy food at a discounted price.
It must be tough doing this on Zoom and getting cut off by clapping, but thank you very much. You did that really entrepreneurial thing of answering about 5 questions that weren't asked. Let's get it all in there. So, Peter, we'll come to you first next time. Thanks very much, Sandeep. Well done. Now, next up, one of our innovators, Camille O'Malley, couldn't make it today due to COVID. So, in true entrepreneurial style, someone was nabbed at about 9:30 last night and told they were pitching about 12 hours later. So, a big warm welcome to Sian Farrell of Stim Oxygen.
One in 2 people will develop cancer during their lifetime. This terrifying statistic simply means that effective treatments are needed more than ever. But why do our gold standard treatments fail? Well, virtually all solid tumours have low levels of oxygen, and for treatments such as radiotherapy that work by converting oxygen into a toxic weapon against cancer, how can we expect that to work if there's no oxygen there in the first place? If I told you this problem was discovered over a century ago, you might think, how has this not been solved by now? Because cancer is just as smart as we are. But on this occasion, it's been outsmarted by a small and unique company based at the north coast of Ireland. At Stim Oxygen, we've developed a nanoparticle that can fuel tumours with oxygen and boost the effects of many different cancer treatments, particularly radiotherapy by up to 300%. What we need now is £1.5 million of funding to get us through a first-in-human trial. Our fundraising round starts at the end of this year. If you're interested in coming with us, please come and find me, and let's save the lives of people on a global scale together. Thank you.
Well done, Sian, and well done on jumping in at the very last minute. Peter, we'll start with you.
Thanks very much. Sian, my question is really, you mentioned that you can, if you can increase the effectiveness of the treatment by up to 300%, especially with radiotherapy. So I was very interested to know, is it possible then, that, and we talked about personalised medicine yesterday, earlier, I think Miriam was talking about it, is it possible then that you could reduce the side effects that come with treatment so patients don't have to get as much treatment that has difficult side effects?
Absolutely. This is something I'm really passionate about, because we know the harsh effects of not only chemotherapy but also radiotherapy. And by us being able to provide patients or oxygenate those tumours, we could potentially reduce the dose of radiotherapy given, and we could also potentially reduce the amount of cycles given. So at the minute, someone going through breast cancer could be going through a 3-week cycle of radiotherapy treatment, maybe Monday, Wednesday, Friday, and having to travel very far and wide. Before there was a centre in Derry in Northern Ireland, people had to go to Belfast, and that's not great that's an added burden to families. If we can reduce the amount of cycles given, it increases their quality of life, but also reduces side effects, as you say. So absolutely.
Great. And Marianne, I think last night about 9 o'clock you agreed to do about at least half the funding round, I think.
Yeah.
So
I was going to sell my bracelet. That was about. Yeah, thank you very much for the ask of the 1.5 for your clinical trial. Yes, I'd like to know, this is nanotechnology, correct? That you're doing with the oxygen injection into the. Is there a device involved? Is it going to be how? Can you just go over the process a little bit?
This is a really important question because. Of course, we've developed a great technology, but it has to be seamlessly translatable into clinical practice. So we've designed this so it can be intravenously administered. More than often, a patient's going to be in hospital, they're going to have a cannula in their arm. All we have to do is reconstitute our vial with our little nanoparticles, shake it up with water, into the vein, goes to the tumour site. So some of our competitors at the minute, they're developing some kind of similar technologies, but the way they're administered is via an intratumoral injection, which needs MRI guidance and sophisticated techniques just to get the treatment there, whereas we can just pop it into the vein and it gets the tumour by itself.
Great.
That's pretty scalable.
Sean?
I'll go super fast. Use of funds for the 1.5?
Well, so currently with limited funds I have, I'm trying to de-risk the project as much as I can. A big thing will be making sure that we're able to scale up, manufacture our particles, so we'll have to. Basically, once you go to a clinical trial, everything has to be GMP-based, so good manufacturing practice. I'm doing something similar at the minute without the GMP label, and it could cost me maybe £50,000. Once GMP's at it in front, it could cost you $500,000 just to make sure and of course it has to be well regulated to go into a human. So that's a big part of it, of course, sourcing the clinical site and getting people on board to help accelerate.
Perfect timing. Your time's up. Brilliant stuff. Well done. Great. And sorry, I should have said earlier on, somebody really wanted to be with us, but again, like someone else earlier on, visa issues meant he couldn't be here, so he was on Zoom. So our third and second to last pitcher is Alphonse Cornicero Carmona. You're going to kick me later on for that pronunciation. Yeah, okay. Alphonse, I'll hand over to you because no one wants to hear me butchering your name.
You would be wondering, who is this guy? He's my father, and he is the reason why I'm here today. 8 years ago, he had a stroke that paralyzed half of his body. After watching him in rehabilitation, when he was struggling, I started a journey to create technology to improve people's life. People with disabilities could walk again if they had a robotic exoskeleton. However, current devices are very expensive, as they cost more than 100,000 euros and very heavy. Therefore, they are only found in large hospitals and are out of the reach of the patient. This is why we created ABLE, a new generation of exoskeletons that are 2 times lighter and 3 times more accessible than current solutions. The technology has been tested by over 100 patients, like Ricard, who is completely paralyzed from the waist down due to a spinal cord injury. We have also performed clinical trials in leading hospitals.
That's your time up. I haven't figured out how to clap and hold the microphone at the same time. Marianne, let's start with you.
Your device looks very light as opposed to some of the other ones that we've seen, with Mark Pollock and other people who have been working with this. Do you use some sort of sensor in the spine that actually triggers the brain in which to work?
No, it just has several sensors, but in the device, nothing implanted in the body of the person.
And the app, does it have something that goes cumulative knowledge that helps, it learns as it goes with the patient?
Exactly,
okay.
Yeah. It goes together with a mobile app that allows to personalize the way the patient is treated and learns in order to set the correct parameters to provide a natural gate.
And this is in the cloud, so it can be cumulative knowledge for any location or hospital or therapeutic center.
Exactly.
Okay.
And from this cloud, then you get, for example, all the sessions from each patient, and you can set up a proper training program to enhance the possibilities of all those individuals to rehabilitate in the most efficient way.
Sean?
So very relevant. I have a daughter who's using similar technology to learn to walk. Is the product scalable down and up? So you have a lot of adults in this. Is it children of any age, or is there a starting point for when people could use it?
Yeah, that's a great question. This first product is for adults. It could be scaled up for people with for child, but the problem then is that a child wants to move. So you need to put some kind of frame or some kind, and then you kind of also lose the sight, because we want to provide this lightness, but if you have a frame around you, then this lightness is not something very important anymore. No? So there are some products in the market for people, for childs, but the concept is a bit different, because a child wants to jump, a child wants to move around.
Alphonse, I can see the obvious application for assisting someone to walk. Do you have any plans for applications in rehabilitation or helping people get some recovery?
Yes. This first product is a product for hospital. So our customer is a B2B, the customer is the hospital, and their hospital use this device as a way to rehabilitate the patients. So it has been demonstrated that using robotics during rehabilitation provides better clinical outcomes than regular therapy, that conventional therapy, which is just manual therapy. And it's also more efficient in terms of therapies, which is key, because the number of neurological diseases is growing exponentially. So we as a society need to provide a better tool for this.
And you've got 3 seconds left, so I don't think we'll get a last question in. So thank you very much, Alphonse.
Thank you.
And finally, our last picture of the day is someone who probably has the best job title in the room, I think, Chief Dream Officer at Sleepify, Michaela Stephen.
One, 2, 3. In the last 3 seconds, 3 mattresses ended up as waste in Europe. In fact, 30 million end up as waste every year, equivalent to 20,000 stacked Eiffel Towers. The problem? Mattresses are designed to end up this way. But what if they could be designed with no waste in mind? That's the question that got my co-founder and I curious, and that's how Sleepify was born. An award-winning startup creating a circular economy mattress renting solution for hotels. Our mattress is proudly made in the EU with just 2 high-quality materials and features a patented adhesive and product passport for easy recycling. Our carbon footprint is 50% less than conventional mattresses, and our materials can be endlessly reused. No more waste. And we're just getting started. We secured our first investment, are onboarding our first customers, and we're now asking for further investment to grow our team and scale. Come join us and let's put mattress waste to bed.
Well done. Perfect timing. All right, let's start at the end.
Thanks very much. My question is really about, you mentioned customers. Who is the customer? Are you selling this direct to consumer? Can I buy one? Or is it hotels? Is it, who is your customer and how are you going to get to them?
Yeah, very good question. So our first customer is B2B hotels, so hospitality industry, for various reasons. First of all, they're overcoming COVID impacts hugely, and they're about to be hit with incoming regulation, especially in terms of the Green Deal in the EU, where they have to become more sustainable in line with ecotourism. So we see this industry as an industry that needs help, and with our solution, we cut their CO2 per room, and we also provide them with premium sleep for their guests. So we're really giving them kind of 2 quality add-ons to the market.
Plans to go to consumer, or is it B2B?
For now, we're sticking with B2B. Firstly, mainly impact-driven, to be honest. More impact can be created with B2B at first, but we would eventually go B2C. So one day you can all buy your own Sleepify mattress.
And Sean, that sustainability side is really key at the minute in startups.
Yeah, so I don't know if it's like the other B2B kind of products where they're shipped in a like compact foam box. That helps for shipping too. I love the idea of returning, but typically that's the expensive part because it's a fully, rolled out mattress. Is there a plan for that to help with the shipping costs on the back end?
Yeah, so right now we're focused on Austria. That's where we're based. So our market is a German-speaking market, and we transport at the moment with fully not rolled up mattresses because they're too quality driven at the moment to be squished. They're not like foam. Foam is very cheap and a lot of chemicals, and they can roll back up into the shape. But with our spring mattress, that's not fully possible. But we do plan to get there eventually. We're at the start, but we want to do that to reduce the CO2 as well. So.
Marianne.
What's your price point right now per mattress?
Yeah, so per mattress about 500 to 600 euros. So we're very competitive on the market.
And what would you need to scale and also to put that price point down?
Yeah, we need to scale by, well, to scale first of all, we need to get the recycling part of our product in place, which we have already started testing. 75% of it can go back into be turned into a new mattress again, which is basically unheard of on the market right now. So we need to get that much better, which we're doing, and then that can make it more scalable to take the old mattresses and make new ones, but at the same time have our producer as well, who's based actually in the Netherlands and has the capacity to scale with us across the German market. So we're ready to basically hit the market and go. We just need to now prove it with the customers.
What would be your desired price point for their consumer product?
For a consumer product, it would be probably around that 500 to 600 mark as well. We want to make it accessible, but we're not going down to your cheap IKEA offering because we can't, it's a more sustainable product, and by nature it's slightly more expensive.
Diminishes the brand.
Yeah.
Brilliant. That's your time up. Wonderful. Thank you very much. I think we should just give another massive round of applause for all four of our pitchers today. I can say as a failed entrepreneur, it's much more fun being on this side of the table than it is on that side of the table, so well done. I just wanted to wrap this up by again going back to that Norwegian word, dugnad. I think whilst you're having your lunch today, think about how you can help any of the four speakers today, because they all have amazing businesses, and you could be the person that unlocks £1.5 million or whatever they need. So please do talk to them. I'm going to hand back to Natasha now, and thank you very much.